One thing I've noticed in photos and just looking at my head sometimes is there are periods where it looks like I have like total coverage and everything's looking great. And then other times, particularly when I start growing my hair out a few inches, where it looks a little bit patchy. Part of the reason for that is I have significant body hair. I'm not like an expert at the different cycles of catagen, anagen, and telogen, but I know that leg hair, for example, has a shorter anagen phase. And even though when you look at your legs and they always look consistently hairy, there's like a cycling happening between some hairs growing, some's not, and some's growing longer and some isn't. To compensate for that. I mean, this happens with head hair too, but you have this critical mass and the cycle is longer that it just never really looks like you have a bald patch if you have enough hair. So I think the fact I've used body hair, in particular body hair types, is causing my hair to look good sometimes and less good other times. That's a reality of using body hair, and particularly leg hair and chest hair to a certain extent. As far as I know, beard hair, even though texture-wise it's different from head donor hair, it tends to have the same cycles and just growing longer and thicker. So the beard hair seems to just always be there. But then there's patches around the beard hair. Sometimes it looks good and sometimes it looks less good. And I'm realizing that is due to the volume of body hair I have used. And I've said this before and I'll say it again. So if you have head donor hair, always use head donor hair. It's just always going to be the best resource. But if you're like me and, really your only resource and you want to have as much coverage as possible, it's a reasonable compromise and sacrifice, but that's a reality you should be aware of.
All right, here we are in Japan and beautiful Mount Fuji. What? That is not Mount Fuji. It's in Thailand. In a Japanese garden in Thailand. Oh, not that kind of golden shower. This tree is called our golden shower. Interesting name, perhaps lost in translation.
So for a little over a year, I've had this redness on my upper lip and the mustache area. And I actually went to a dermatologist about 6 months ago and we weren't sure if it was some kind of infection, and I took antibiotics and I put cream on it and it seemed to get better, and then it came back. And then I went again and they said there's some kind of vascular problem and I need what's called a PDL laser. So today I went to a clinic and the doctor took a look and he noticed these like little white dots that are the FUE scars. And first he was nervous. He said, "Oh, something else is wrong with you." I said, "No, I had the FUE extraction, my beard and my mustache area 6 years ago. But I've had this problem about a year." And then I saw a light bulb go on. He said, "Oh, that damaged the capillaries. And even though that was 6 years ago, it's just emerging now." And that makes sense to me. It's very likely. So I went ahead and I had this laser treatment, and I'll have to go back 5 more times. So it looks more red right now, but it has been similarly red for a while. And I noticed a lot of FUE doctors avoid this mustache area. And honestly, that's probably a smart thing, because you have the risk of having this, I don't know what they call it, vasculitis or red skin that you might need a laser to treat if it's even treatable. And I'm sure it could happen in the beard area too, but there's usually like plenty of other hair and it's less noticeable, less prominent than like right on your face. So you can take FUE from the mustache area, but I gotta say, I don't recommend it. I mean, I didn't really even get that much and I have this redness. It's a risk I didn't even know about, but I'm telling you now, it's best to avoid the mustache area as a donor site if you can. Just looked it up here, pulse dye laser. So pulse dye laser. Now you know. So it's called a PDL laser, or as I said, a V-beam here in Thailand. And that type of laser is particularly good for areas that are red, sometimes called rosacea. It has a couple different names and a couple different reasons for it. It just had my 5th PDL laser session. Each time have been progressively stronger. So you can see I had this brown bruising this time. It's October 4th, a few days after I've had that most recent PDL laser session. Let's see, I still have the redness, it's healing. This is called purpura. And what's happening is the laser pulses and it destroys the capillaries in this hypervascularization. And their blood gets trapped temporarily under the skin. It looks much worse than it is. In a few days, it'll be gone. Certainly a pain in the ass. And had I known this was going to happen, I would not have gotten FUE in this area. The skin is thinner and weaker in this area, so it's prone to hypervascularization. Um, Even when I have the redness, I can grow the facial hair that I still have remaining, and it's not super evident. I would like to get rid of it. One other thing about the PDL laser, at first, the doctor was using a lower setting, and he waited a couple times at that lower setting. And then on my fourth session, he went stronger. And then the fifth session, he went the most strong. Though it is disconcerting, seeing this purpura is actually a good sign. It means that the hypervasculated, I'm making up words here, the hypervasculated capillaries are basically being destroyed. Now you have plenty of other capillaries, so that's all right. But this is what it takes. If you Google the PDL lasers, you'll see people who have all kinds of skin problem, port wine stains, and other things. And they'll have this similar purpleness that lasts a couple days. And then goal, of course, is to get rid of the redness. I already see it drying and going away a little bit. So I expect 3 or 4 more days and it'll be gone. I have my last session. And then from that point, I'm just going to wait and just, because sometimes it gets worse before it gets better. And we'll just see how it goes. Just a little update there, but let's take a look at my hair. It's this right side here. Okay. Take a look at this side. Go to this top here a little bit. Probably need a mirror, but we'll do our best. Get this back here. Again, probably need a mirror. In addition to the headaches, I was also experiencing some muscle pain. It just felt like my hamstrings were very tight, but I soldiered through it. And right now I'm having absolutely no side effects. So I'm glad to be on the stronger DHT blocker, and I plan to stick with that. We'll see how that goes. This hopefully will all be healed up soon. I'll keep you updated on that. I think at this point I have experienced just about everything possible, good and bad, from hair transplantation. I look like some type of cancer patient right now, but this will be gone soon enough. And I have noticed some general thickening on the sides, and I guess really throughout. If hair, has been miniaturized to the point it's dead, nothing is going to bring it back unless they have some type of gene therapy or miracle treatment in the future. But as far as the DHT blockers, that is not going to bring hair back from the dead. Though if it's close to dead, it will come back. All right, we'll see how this beauty mask works. My wife swears by it. Hopefully accelerate the healing of my bruised and broken capillaries. Okay, this is October 8th, a few days later. You can see the purpura has largely resolved. There's no more purple. Some of the redness remains. And that's partially because I continually have these PDL laser sessions every 2 weeks. And as it's getting better, then the laser agitates it again. And the reason for that is to get rid of all the excess blood vessels. So it's not going to completely have a chance to go away until I'm done my final session in a couple weeks. And then from there, it will take several months to see how well it worked or not. But that's how it's looking without that purple color. So as I mentioned, this apparently is a consequence of having this FUE extraction in this particular area. Right now, it actually looks a little worse than it would if I had not done the laser. But the whole point, and ideally, after a few months after doing the laser, it should totally resolve. We'll see how that goes. All right, this is how it looks immediately after the 6th and final session. Even if it doesn't get all the way better, I'm not going back for more anytime soon. I might, assuming it does help, I might go back once a year for some type of maintenance if necessary. But let's have a look there. So it's on the edge of that mustache area was the worst. Every time he has been using higher power, and this most recent time he again used the highest power. So it'll probably look worse before it gets better, but seemed to really make a nice improvement last time. So I expect it will get better after a couple weeks. And then after 3 months, I think maybe it'll be completely gone. I'll have to update you then, but then I'll be in for this series. More look. Hair is looking good. Just need to get rid of that purple, and it's very well named, though I think it's going to turn black this time. All right, see you later.